Today, we are going to be talking about incontinence products, more specifically, the incontinence range from Lil-Lets with their pads and liners. We are going to be chatting to Megan Ross, who is an award winning writer, a mom, and the responder manager and lead moderator for the Lil-Lets Talk platform, a powerful free online platform dedicated to answering all of your menstrual cycle and incontinence related questions run by Lil-Lets. Enjoy today's episode as we cover incontinence that you've heard me talking about on this season of the Nurture Pod, and you will continue to hear me talking about because it is an incredibly common condition, a common experience, as well as a necessary topic to break down taboos, normalize the conversation, and to really just make sure that we all know that there's help out there and there are also products that can keep you out, active, and social while you manage your incontinence concerns. So, enjoy. Welcome to today's episode of the Nurture Pod, where we will delve into curious questions in pelvic health. I am Candice Langford, a pelvic health physiotherapist, eager to explore the minds, skills, and expertise of pelvic health professionals, and of course, share those conversations and learnings with you. But first, let's talk about bladder leaks. Are you using the correct pads or panty liners? Because periods are not the same as pee. I'm excited to share that Lil-Lets have a new range of drylock pads and panty liners specifically designed for incontinence with 3 times more absorption. Pads and panty liners are not a band aid solution to leaks. As a pelvic health physio, I believe that the correct products play an important role in giving you the control and the confidence to move through your day whilst working with professionals to improve your symptoms. All right, Megan. So, if you can tell us, please, what has inspired the creation of the Lil-Lets Incontinence range?
Awesome. Thanks for such a great question. So, the Lillette's team found that people were actually self solutionizing with normal menstrual pads. And so they recognized a need for the drylock range. And keeping with the same brand family that is familiar to those who already use our menstrual products is also comforting, especially as this is an area where a lot of people might feel a bit of shame or embarrassment about their experience with incontinence. We also really wanted to take incontinence out of that quote unquote oops space and provide education alongside the products so that people who are struggling with bladder leaks would also know that they need to seek medical attention rather than just deal with it. Um, Education and empowerment have been key aspects of designing the drylock range.
Absolutely. I want to just pause here. I so value what Lil-Lets have done with this range with regards to we're not just trying to put a plaster on things, we are providing education, empowerment, we're normalizing the conversation. And I really, that's that was the reason why I was so keen to jump on board and get involved, was just because it wasn't a product launch in itself. It was a product launch with empowerment and education, which is what we need to be. People might say, oh, well, why is there a pelvic health physio working with a pad brand and trying to put this plaster over it, right? And the fact of the matter is that they still necessary complements to the experience. This is going to get you out the door. It's going to get you to continue to play with your kids outside. It's going to give you that confidence while you work with someone, while you manage those symptoms, while you are educated and slowly learn to understand what it is that your body's going through. So they necessary complements. We don't want, some people may need them alongside physio. Some people may need them even after having physio, even after having whatever intervention that they go through. But some people might need it to bridge the gap while they are working with the physio until such time as that they no longer have experiences of incontinence. So I really want to commend the brand. I'm really so excited that education was so important to you and so high on your agenda. It's something that I'm sure that people are going to now start looking up to and wanting to follow suit, because I'm sure I'm sure all of your customers are going to really feel comforted and confident, even more so in the brand, knowing that you really have their best interest and their health at such a high priority. So amazing, amazing work that you are all doing. Really, I'm floating your boat now, and it's not just because I'm working with you, but it's just because it's so refreshing. Okay, so you can see I'm excited about this. But let me
No,
just kind of
you're
get
so right.
so let me just ask you a couple more questions. I just have a few for you because I just want everyone to know and understand what it is that we've been talking about in every episode. So, what is the difference now between the drylock pads and the panty liners versus those menstrual versions, those regular menstrual versions that people have potentially been using? Um, in the presence of incontinence, because I've had many patients that have I've asked them, okay, they said yes, I have to use a liner a day. Well, what kind of liner is that? Oh, it's just the one that I would use for my period if I was spotting, so like a light liner. So that's really, really common, and I've always said to people, no, we need to make sure that you're using a pad that is absorbing that type of fluid that's designed for that. So if you can just really kind of help us clarify what's this difference between the dry lock pads now.
Fantastic question. And that's such an amazing insight because the drylock pads and panty liners are specifically designed for urine. They're designed for pee and not menstrual fluid. So they utilize something called our drylock technology, which essentially keeps one dry for longer, which is fantastic. That's what we're after, right? And it does this by locking in moisture. And in fact, the panty liners are 3 times more absorbent than regular panty liners, while
Awesome.
the dry lock pads offer 3 times the dryness of a regular pad that is designed for your period. So, although they're not scented as well, they are able to reduce odor, which I'm sure is something that most certainly would be on someone's mind if they're struggling with
Mm,
bladder leaks. Um,
totally.
yeah, but essentially, the drylock pads and panty liners are specifically designed for the fluid, for urine. They are not just like a normal menstrual version, they've been designed specifically for this.
Okay, great, great. Okay, so that increase in the amount of absorption, keeping those tissues dry for longer without necessarily drying them out, right? We're just trying to keep the tissues dry for longer, so you're not sitting with a wet pad against your skin, or you're not sitting with wet knickers, so that you can kind of move around confidently. And I like that you brought up that they're not scented,
Mm,
because you know we don't need that. We don't need to try and walk around with floral scented vulvas. Your
exactly.
vagina smells like your vagina, your vulva smells like your vulva, like that, and that is good as it is. It's amazing as it is. Okay, so not scented, but is protecting us from that smell of urine, because that's another thing that has been brought up time and time again. Patients will say, I feel like someone can smell me. That's what keeps me away from social circumstances. Like, I'm worried that I'm sitting at lunch or I'm sitting at tea and I leaked a little bit on my way in. Now, can this person smell me? And instead of just indulging and being social and living our lives and getting that social interaction and engagement that we need as social beings, we are now in the back of our heads stressing about things such as smell. So, not scented, but is eliminating that odor of urine in itself. Great, 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 great stuff. And I love the slogan that the brand came up with, that Lil-Lets came up with, and that pee is not the same as periods. And it. I think it's just this catchy line that people are just going to hold on to, and it's going to help one individual to empower many others, because it's just it is what it is. Pee is not the same as periods. We need a product for the one, we need a product for the other. They are two different things. We've got two different absorbencies that are needed. So I really love that little line that's come up, and I've definitely said it a couple of times since I've heard it, which is really cool. Okay, so just moving on to our last question that I have here for you, Megan. If you can tell us about the three different options that are out there, because so we've heard you say pads, we've heard you, when we were referring to menstrual products, we're talking about liners. So there's pads, there's regular, and then there's long panty liners. Why is there this difference? When do we use them? Tell us what that's all about.
Awesome. So the Lil-Lets regular drylock panty liners are designed for those who experience very light bladder leaks, such as drips and dribbles. These are really for people who might pee a little when they laugh or sneeze. So
Mm-hmm.
the regular panty liners are ultra slim, they're super soft. So you're getting that same discretion that you would have with a normal panty liner, except this one is specifically for bladder leaks.
Yeah,
So, as
yeah.
I mentioned before, the panty liners offer 3 times the absorbency of a normal panty liner. So, you're more covered, quote unquote, than you would be
Mm.
with a regular panty liner.
Okay.
And by regular panty liner, I mean one that you'd use for discharge or, when you're spotting and that. So, then we have the Lil-Lets long panty liners. So these are designed for light bladder leaks still, but for those who are looking for that little bit extra when it comes to protection. Again, they're also 3 times more absorbent than a regular panty liner, but they're still slimmer than wearing a full blown pad. So you've still got that discretion and that sense of lightness that a panty liner gives you. But then you're guarded against, leaks, especially if your leaks are light. However, the drylock pads are then for people who are experiencing moderate bladder leaks. All right, people who might need a little bit more protection than a panty liner, and even the long length panty liner might offer. So, what's really great about these pads is they have elasticated sides, so your fit's very secure, which obviously offers a great deal of assurance. And then when it comes to their ability to wick away moisture, they actually offer 3 times the dryness of a regular pad that you'd use for your period.
Okay. Okay. All right. So we've got two liners. One's
Two.
regular, one's long. So those
Right.
are both for the lighter leaks. Um,
Yes.
just remind me there, why is the one longer?
Yeah. So the longer length panty liners are essentially just for those people who need a little bit extra coverage than the regular panty liner might offer. And also, they're designed for slightly, not moderate bladder leaks yet, but we're looking at something a little bit more than, than when you pee, when you sneeze or laugh.
Okay. Okay. So there's just a little bit of an increase in volume, but not as much as one would consider a moderate bladder leak, where one would then use the pad. So, for example, now if someone were to need a pad when they're going to sleep at night, which one would they then choose?
I would totally say go with a pad just for that like peace of mind, just to know that you can go to
Mhm.
sleep. I mean, it's a similar problem, if when you're going to sleep and you're on your period, you want to sleep through. You don't want to be waking up during the night worried, have I leaked here? Have I leaked there? And it's the
Okay.
same with incontinence, like
Mhm.
use the pad, unless of course you're quite confident that your bladder leaks are very light. In which
Okay.
case, you might find a pad a little bit too much, and that might be a bit, too cumbersome or too big for you to sleep. Yeah, in which case stick to the panty liner.
Okay, then maybe using the longer panty liner so it covers a longer portion of your knickers so that when you're moving around at night, you know that you're not having to worry that your knickers have slipped, or I don't know about you, but I wake up and I feel like my clothes are like around and wrapped and under my arm and like all over the place. So that'll just give one that little bit more security if you've got lighter leaks and then you're having to sleep with a longer, more comfortable. Although they both do sound really, they all sound really comfortable. Like you said, the pad, even though it is bigger, it's got these elasticated sides, so it's like a little bit more fitting. But one might feel like, oh, I just want something
Mm.
thinner and slimmer. So the longer panty liner might be better for that person. And then I'm assuming during the day, choosing between the regular liner and the long liner, maybe the longer one would be better suited to someone that knows that they're going to be up and down and sitting and standing and maybe doing a yoga class and moving around a lot more versus just kind of going to the shops, walking in, walking out, or going to stand on the side of the field watching a kid play sport, or then you know that you're not kind of up and down and you might then choose the regular liner. Would that be kind of how you would advise people to
Absolutely,
use?
that's a fantastic way of looking at it. And I think, with the longer liners, because they offer that little bit more, coverage with the length, uh, they're really great for like that movement that you're talking about, because you want to carry on with your life. And I think, to your very first point in this podcast, you were saying, we want people to be living, we want people to be socializing and not feel afraid, and we don't want people to be isolated. And I think that's what's so great about products that fit, products that are comfortable, products that you with a brand that you're familiar with, because you don't feel like you're stepping out of your comfort zone. You feel like you're stepping into your day, and with that peace of mind. And I think that's what's been so important for us with this.
Beautiful. I think that's a great motivation to expand into this
Mm.
very necessary field, because people need it. We can't shy away from it. It's not going to go away, but it is going to rather empower individuals to use the right product, then remain active, remain social, and then also while engaging with your advertising, etc., they'll realize, hey, I can speak about this. We've normalized the conversation. We can confidently chat to my friend about it, mention it to them, and in those conversations, that is most likely when you're going to engage with someone that'll say, hey, like, this is really, really common. 1 in 3 individuals are experiencing this, and if not more, I'm pretty sure it's more. um, and there's something that can be done about it. Why don't you chat to your doctor? Why don't you see, there's so many options that may be of assistance, whether it's hormone therapy, whether it's physiotherapy, it might be tissue release, it might be exercise therapy, it might be using something like a pessary. There's so many options out there. It might just be changing your breathing patterns when you're doing a certain exercise or maneuver. So there's so many options out there to help individuals, and I really love that there's now this familiarity and this trust in an existing brand that is now expanding and prioritizing comprehensive pelvic health. I think it's just so important and so beautiful to see the way in which you have brought this brand to light. I just want to make mention of the use of these products for potentially someone that is weightlifting. I would think that the thicker pad now would be the better one for individuals that are maybe doing weightlifting and powerlifting and experiencing leaks. I think that would be probably the best one to use in those circumstances, because those individuals typically have a larger volume of bladder of urine loss in those circumstances. And as always, I'm not trying to put uh, plaster on top of these things and ignore their presence and the potential to work with a professional. So please go do so. But I would think that maybe that would be a great scenario in which to use or pick the pad. So if anyone is a power lifter, and I've worked with a number that have tried to improve their bladder health and the way in which they look after themselves. And some individuals will stand on the stage, do their powerlifting, they would leak, they know that they're going to leak, and they're super confident, and it doesn't stop or hinder their performance at all. And that's amazing. But there are others that I've spoken to that feel as though that knowing that they're going to potentially leak if they push themselves that little bit harder, that is what stops them from pushing themselves harder and performing at what they believe is going to be best for them. So the pad, I believe. Do you agree? The pad would probably be the better one to choose in
Absolutely.
that circumstance
For that
for that large
large volume
volume
loss,
loss.
absolutely. And I think, again, it comes down to confidence. You want to know that you can step out there, do your thing, whether you're a power lifter or a brand new mom, just someone. anyone going about their day who's experiencing bladder leaks, you really want to just have the product that makes you feel like, okay, I don't have to hide, I don't have to be ashamed. This happens to other people too, which, as you say, and I think I admire you so much for this, you've said, let's not normalize the problem. Let's not say that this is something that you should be experiencing, or that it's okay, but it is common. And I think that's been such an important learning curve for all of us, to really pick up on.
Yeah.
Yeah.
Amazing. And then the second kind of group of individuals that I want to just mention in this episode would be those that are wheelchair bound individuals that may have sensation loss. They may have a new onset of incontinence. It could even be individuals that are now newly experiencing having to walk with crutches, for example, or someone that's walking with a prosthesis for the first time, or someone that's had an amputation. For individuals that have disabilities, these products are going to really be amazing with regards to expanding their range and their choice available to them for helping to manage such circumstances of leaking, and also just making sure that these individuals, if you're dealing with a new onset incontinence alongside now having to learn how to mobilize with a wheelchair, or learn how to mobilize after amputation, we really want to provide products that are going to take that one bit of stress off of that individual's shoulders while they first learn and manage and deal with mobilizing in a wheelchair. And when they're ready, that person might say, okay, I've done this, I'm feeling good, I'm feeling confident, I've been able to do that and embrace that because I've had a pad to get me through. And now I'm ready to chat to the pelvic health physio. I've got the capacity to now work on X. But that pad is what has gotten that person to be able to push themselves with regards to learning those new skills up until the point where they can now say, okay, now I'm ready, because we don't all have capacity all at the exact same time, right? Sometimes we just need to deal with one thing and then the next and then the next, because we are complex human beings. We live complex lives, and there's so much going on all the time. So, yeah, I really think that expanding option, variation with regards to what to choose and which circumstances one would choose a certain line or pad is just such a blessing. And I'm so grateful. I'm just going to say it now, for the amount of effort and energy and learning that has gone into this with regards to the Lil-Lets team. It really is commendable. So yeah, thank you for making this available to our community. Um, is there anything else that you would like to kind of finish on? Is there any, last points or kind of rounding off, or anything that you wanting to
Well, I
say
think
before we
just
head out?
personally, as someone who's been postpartum, my child is 7 years old, and like, if I had known at that point when I was experiencing, like, quite typical bladder leaks, if I had known then that there's a product that I can just get, that's something, I've gone from like the maternity pads, and now I can go to, like, say, inco pads just while I'm like experiencing this issue. I think that would have made a huge difference for myself. So I've just found, like, working on this campaign, I just feel very, very passionate about it. I think if you can, as you say, take one thing off someone's shoulders, and to that point as well,
Yeah.
help someone's mental health as well. Like, give someone peace of mind, give them confidence to step
Mm,
out into their day, and as you say, not mask the problem, not put a band-aid on top of the problem, but really, really just help someone get to the point where they're getting the interventions that they need. I think that's been at the heart of this whole campaign.
yeah. Oh, lovely. Absolutely. There's lots of heart that has gone into this campaign on behalf of the team and each individual. I can see your passion as we are chatting. I can hear your passion as we're chatting here. It really is important to you. It's important to the team, and it's been beautiful to see. So thank you so much, Megan. It's been wonderful to chat with you and hear
Thank you
more
so
about the
much, Candice.
products.
Really appreciate you having us.
In addition to the amazing insight that we have gained from Megan about the Lil-Lets incontinence range, I wanted to just go through a couple of things that might help you now that you're feeling like you know and understand the product range, and you might decide to reach out to a healthcare provider to just chat about your current experiences whilst using the correct pads, of course, or liners. Okay, so if you are planning on going to the doctor, it's always valuable to arrive with some information. If you arrive with nothing, that is fine. Go chat to your doctor and they will ask you questions that will help you to really work through what it is you are experiencing. But if you arrive with a little bit of information, it can always be helpful. So, what you might do is for about 3 days, but up to a full week, you might start to really pay attention to what is happening. Try to take note of when you leak and how much you leak. You might decide to keep a bladder diary, which in which you would record your fluid intake as well as your output, which is not as important as taking note of and documenting when you leak and what causes you to leak and the volume of leaking. So, for example, you might find by doing this for 3 days that after having a cup of coffee, you tend to have a sense of urgency where you have to run to the loo. While you are running to the loo, you feel like there's a little bit of a drip, drip, drip. And then when you sit to empty your bladder, you might also document that you actually can't quite get that urine out. These are all valuable bits of information for the healthcare provider to have in order to guide you going forward, whether it's your GP, whether it's a urologist, or even with your pelvic health physio. I can assure you that these are all important and valuable pieces of information to have. You might also find that it's particularly in the evening and after writing things down, you might realize, oh, okay, wow, I really drink a lot in the evening. It's a lot of water while I'm having my dinner, and then I down a couple of glasses afterwards. And after that, that's when I tend to get a little bit of urgency and I feel like I need to run to the loo. You might find that, oh, okay, it's in the middle of the day. Whenever I sneeze, cough, or laugh, that's when I'm getting a little bit of urine leaking. And if I've had a cup of coffee, then it's no longer a small little leak, but rather a large leak. Those little bits of information can really, really be very helpful. So you might find all sorts of different patterns, but you can Google a bladder diary and that can help you to document. Otherwise, you can just make notes on your phone about the last couple of days as to when you leak and how much you leak, and if there's any specific notes that you can take on those points. If your provider might want you to give a little bit more detail, and I'm not surprised if they do, but sometimes they will gain enough information just out of these little bits. If they require more information, they might give you a specific tailored bladder diary that's going to help them to decipher exactly what the aggravating factors are and anything that they can potentially see to intervene. Another thing that you can bring to your doctor's attention or your healthcare provider's attention would be the types of pads that you are using and how many you go through in the day or in the night. So you might say, I go through three you might say I go through 3 full pads on the weekend, and then we start to notice, oh, okay, on the weekend that's when you have 1, maybe 2 glasses of wine, or that's when you're more active, compared to during the week where you say, okay, from Monday to Friday I typically go through 1 pad, and that might then be associated with the amount of fluid intake or your behaviors, etc. These are things that we can try to work through. But having a little bit of insight about when you leak, what causes you to leak, and how much you are leaking can be valuable, but also giving the doctor or the provider some information about what type of pads you're using and how many you are going through. This can be a really nice little objective measure to monitor your progress with intervention. So you might go to your physio, get a couple of exercises, which might be release, relax, lengthen type work, as well as strengthen work. Remember, it's not just about doing activation. There is a lot of value in working through the full range of motion of your pelvic floor muscles as well as the surrounding joints. So you might then, after a week or 2 weeks, report back and say, wow, okay, I'm only ever using one pad. So it's a really nice objective measure to provide. Then another point that I would like to bring to your attention, and something that has come up in practice and a couple of other times as well, on social media, etc., is tracking. When exactly is this incontinence happening, or this experience of wetness in one's knickers? So there's been a number of times where I have advised individuals, okay, well, why don't you track when it is happening? Because it's inconsistent. It's only every now and then, but when it's there, then it's really bothersome. So sometimes we actually need to differentiate between cervical mucus at the time of ovulation, causing a bit of wetness in one's underwear, versus there being incontinence. Because sometimes individuals experience a very subconscious loss of urine, and they might end up going to the loo, and when they pull their knickers down, then they notice, oh my word, it's wet. I don't even remember leaking. But that can also be confused with a normal experience of cervical mucus at the time of ovulation. So if we track our menstrual cycles, we don't have to be hyper vigilant about it, but just get to know when it is that you are going through ovulation. Sometimes we can start to see, oh, okay, I don't need to panic. This inconsistent and irregular wetness that I'm finding in my underwear is actually more associated with my time of ovulation. And that can really ease a lot of panic. But you can absolutely chat to your healthcare provider about that too. I just felt that it was an important point to bring across here. Then the next thing and the last thing that I want to just quickly add to this episode is your bladder habits. So making sure that you are drinking enough fluids during the day. Obviously, we are not wanting our fluid intake to be primarily fizzy drinks, sugary drinks, etc. But we do need to get some water in. You might want to take that fluid intake with some tea. It might be nice little herbal tea that just helps you to get more fluid in. With that, some individuals do find benefit from rather sipping fluid during the day as opposed to downing fluid and thinking, oh my word, I haven't drank all day. Let me just down some at breakfast, down some at lunch, and down some at dinner time. Some individuals can do that perfectly fine with no issues, but others need to pay more attention to how much they're taking in and how frequently. So if that's you, potentially try rather sip through the day. As opposed to downing fluid just to try get enough intake through the day. Remember that we also get sufficient fluid intake from our veggies and our fruits, and then outside of that, we do need to drink to thirst, depending on your activity and the temperature of the room around you, the temperature outside, etc. That might vary in the amount of fluid intake that you're taking on. A lot of the time, when it comes to individuals experiencing incontinence, they believe or they feel like the resolution will be in restricting fluid intake, and that is absolutely not the answer. We need to make sure that you're still getting adequate fluid intake. There is some theory around that darker urine causing more irritation to the inside of the bladder, causing more frequency, more urgency. So you don't want to now go dehydrate yourself, which can potentially then make the symptoms worse in order to try and resolve, because it's working against you. So please rather use the correct pads, work with a provider, make sure you're taking enough fluid intake, and rather manage these symptoms in this way, as opposed to restricting your fluid intake, because water is important for you. Okay, and then with this, I like to just make sure that you are filling and emptying your bladder entirely. So usually what I say to patients, obviously, you know, each situation, each patient, each experience is absolutely unique. So there's no blanket coverage. But what we can try and stick to is around about the 2 to 4 hour mark, making sure that you are getting enough fulling occurring, as opposed to going every 45 minutes, every hour, where you're not getting adequate fulling of your bladder. So if we can delay the first urge, empty maybe around the second urge, around the 2 to 4 hour mark, please chat to your provider if this is you, because it really does vary per person. But making sure that you're filling your bladder adequately, and the important point to take home here is to not go to the loo just in case all the time. So if you're going to the loo just in case 5 times a day, then you're probably going to be going too much in that day. Sometimes going just in case, in inverted commas, is adequate, right? You are going for a long drive and you want to feel comfortable, and you go and empty your bladder just in case, just so that you know that you can get through that long drive without any urgency. And if it's going to give you ease of mind, then go and do it. But if you're going just in case, like I said, 5 times a day, then we really need to start to reconsider how much just in case you are doing. But please don't be too alarmed or hypervigilant or hard on yourself, because sometimes we do need to do so. So making sure that you are filling your bladder entirely, not to the point that it wants to burst. So we are getting enough intake, we're filling the bladder enough to the point where then you are going to now go and empty your bladder, but you don't want to go and delay the urge to urinate 3, 4, 5 times, and then your bladder feels like it's going to pop, because when you are then overfull, the likelihood of you leaking in that circumstance is even higher. So we can absolutely go into more detail about this, but I'm really just trying to cover the basics here. So getting enough fluid in, taking it in relatively slowly as opposed to downing it, making sure that you're not emptying just in case all the time, or you're not emptying on the first urge all the time and going every 45 minutes, but rather trying to get a void in every 2 to 4 hours. They say around about 8 times a day, but everyone is different. And then when you are now going to empty your bladder, instead of bouncing on the spot and jumping up and down and really feeling like you're having to hold your breath and squeeze your knees, rather practicing strong exhales, nice pelvic floor activation on those exhales, and walking more calmly to the bathroom. There's a couple other techniques that one can implement at this point in time. And then when you're sitting on the loo, trying not to push and power pee, right? We don't want to hear Victoria Falls or just like a waterfall when you're sitting on the loo. It should be relax, sit, do nothing. This is your moment. Sit and relax just for for 1 to 2 minutes, and just chill. Let your bladder do its work. Might be over in 40 seconds, but you got 40 seconds of relaxation time, which is great. Don't push your urine out. And then take note at this point, if when you stand up to walk away from the loo, if there is any leaking at that point, and that would be something that you would bring to your pelvic health physio's attention too. Okay, before I go on for too long, I just wanted to make sure that we had a little bit more insight, and maybe I can do a longer or a solo episode on this and just kind of repeat these things in another shorter episode. But that should cover a couple of those details. I am so excited to have a brand that is conscious of the necessary space for education and empowerment about using the correct products, but also advocating for one's education and intervention that is appropriate to help one work past that experience of incontinence. Okay, amazing. So much talk about we all in one day. I love it. I shouldn't be surprised. I talk about bladder function every day. Okay, great. I think we have covered enough foundations there, little bits and pieces of information for you to bring to your doctor's attention, identify when and where and how you are leaking, and then just a couple of habits to make sure that you're filling and emptying your bladder appropriately. Please chat to your provider. Remember that this is not personalized healthcare information. This is information sharing only, and you will be best served if you work with a professional that you can tell your personalized experiences to. So, thank you so much for listening today, and have yourself a beautiful remainder of whatever time of the day it is for you.
Well, NurturePod listeners, until next time, please review and subscribe, and as always, stay curious. As a special treat for listening to today's episode, you can head over to the nurturepelvichealth.com website and use the code NurturePod for 20% discount on all pelvic and sexual health courses.
This episode is brought to you by the Lil-Lets Drylock Incontinence range of pads and panty liners specifically designed for bladder leaks. Because you deserve to maintain a healthy, happy, active lifestyle in the presence of leaks. This is why when working with patients with incontinence, I encourage them to use the correct type of pads as they work towards their treatment goals.